Good morning, good afternoon, good evening to everyone who's joining us. My name is Dom. I'm a junior doctor based in London, and I'm part of the healthcare team that have delivered the session today. Just wanted to say a very few quick words at the end of what's been a fantastic morning of discussion. Primarily wanted to extend my thanks to everyone who's given up their time to speak today. Thank you very much for sharing your insightful comments. I know I found it fascinating, and I'm sure everyone else in attendance has some really useful insights, and it's great to see the collaboration that's gone on this morning. Also wanted to say thank you to my colleagues at Health Careers Live. I know they have gone to delivering these sessions today, and the quality of the sessions is definitely all of your. So thank you so much for all of your input. Just to summarize today, I think there's been a couple of key points that have really stood out for myself. I think it's been clear that while there is support on offer for international healthcare professionals seeking to make the transition to UK practice, there is also a need for greater support in certain areas. And I think it's fantastic to see that we have organisers like GMT who are supporting these individuals. We spoke in the session, the keynote session, about standardization of that process and improvement in the clinical support available as well that we heard just now session today. And I look forward to seeing how the conversation around those concepts develop. And
that's amazing.
Finally, I think the last thing to highlight was the positives that were highlighted in our training panel. And it was great to hear from individuals who feel that they've benefited from educational opportunities available in the NHS, and that they feel valued by the organisation. I'm now going to hand over to Raj, who would.
I mean, it's been such a roller coaster day so far, and it's I think just being here and being with you all is amazing. From wherever you're tuning in around the world, across the Middle East, across the UK, and really just to add to what Tom said, I think the power really of technology today is we're more connected than ever before, but also we're also quite disconnected. And I think being here together on this platform, sharing thoughts, ideas, energy allows us to really think beyond what's happening locally and bringing in those global insights to what we're doing to hopefully pave the way for a better way of doing things. And on that note, I'd just like to just signpost everyone to what's planned for the rest of the year. So we have further roundtables coming up, South Asia, Africa, Europe, and really the pinnacle of this year is the Health Careers Live Festival, which is the first ever Health Careers Live Festival taking place on the 16th to 17th of September. It'd be great to see you all there. There's going to be a very eclectic mix of amazing people, just like we've had today, sharing ideas, energy, and most importantly, all collaborating together for a better future. And on that note, I'm just going to hand over to Professor Jed Byrne, who is leading the troops towards a better future across the country, but globally. And just a few words for Jed before he does join. So Jed is the global director for the NHS, and he's inspired me to be where I am today, and really supported a whole. I don't know how many people you've supported, Jed, but you've touched countless lives across the nation and globally through what you do day in, day out. And we're really so privileged and lucky to have you here. So without further ado, I'd just like to hand over to Jed.
Thanks, Raj. Much appreciated. And I apologise to anybody who can't hear me terribly well. I'm using the National Health Service's stock Wi-Fi, which doesn't have the greatest reputation globally. So many apologies. My name's Jed Byrne. I'm a surgical oncologist by background. In fact, I'm still a practicing surgical oncologist, hence the reason for the NHS Wi-Fi at the moment. But for the last 10 years or so, I've been working with Health Education England, who are the workforce arm of the National Health Service in the UK, and an executive arm's length body of our own Department of Health. I recognised when I was a medical student nearly 100 years ago that we cannot develop from a health perspective unless we have pan-global relationships. And in fact, if we really want the best healthcare workers that we can have, then what we need to do is we need to allow those healthcare workers to develop strong relationships with other healthcare workers in different healthcare settings. I completely applaud the work that Raj and the team have done in this regard. And what they're attempting to do is to create a real bottom-up momentum of relationships between healthcare workers across the world. Health is fundamentally all about people. If you look at health, about 70% of the world's expenditure on healthcare is on people, not on stuff. And despite the fact that sometimes we get bogged down with buildings and logistics and big fancy kit, ultimately health and well-being is all about the relationships between people, which is a great paradox, really, given that without any shadow of a doubt, the biggest challenge facing healthcare moving forward is the size and the strength of the global healthcare workforce. And my own unit in Health Education England is deliberately designed and has been crafted over the last 4 or 5 years to try to help to alleviate some of those workforce issues using the NHS, which, as I'm sure you've heard today, is the oldest and largest universal health coverage system in history. So that's me in a nutshell, and I look forward to the chat. Raj.
Amazing. And just to add, at the Global Health Partnerships Directorate, we have an amazing webinar with the World Health Organization coming up in early July. And thank you so much, Professor Byrne, for your support and for all the work that we're leading across the UK, not only to strengthen systems locally, but also globally. And on that note, we have a really exciting thing happening today, which is digital MoUs. And you might think, well, what are digital MoUs? MoUs, for those that aren't familiar with the TLAs, the 3-letter acronyms, is a memorandum of understanding. And Tracy and I and Tista, Faisal, Dom, we were all brainstorming earlier. And I'm just going to put this across to Tracy, who's been absolutely brilliant today. And I've been so inspired, Tracy, by your journey. And I think one of the things about today has been around sharing how experience really does shape what we do, and what you've done in your career so far, because there's so much more to do, is tremendous. And I'm going to let you take the floor now and share your thoughts around the living bridges that we're going to be continuing.
Thanks very much, Raj. And first, I'd just like to say, thank you for inviting us to speak today. It's been wonderful to connect with so many of you and to, share experiences. And I think what's become apparent is that there's just so much energy and enthusiasm and opportunity to learn together and to share expertise. One of the things which is, as Jed has previously as mentioned earlier, there's just this opportunity in terms of, expanding all of that global knowledge and global citizenship, and, sharing and enabling the opportunities for us to work together and form collaborations and partnerships. And in Devon, we've only been established for a year, initially looking at international recruitment of nurses and healthcare professions. And part of our longer term ambition within the NHS and within Devon is to actually widen that and to form sort of collaborations and partnerships, so that we can really sort of allow that opportunities to share knowledge and that knowledge exchange. And it's more than just sort of recruiting. It's around sort of sharing and expanding that wider global citizenship, how we can do the very best for health systems. We know there's a massive global health challenge out there, and together we can make a difference. And Raj, we were saying earlier in terms of the, the strength and the benefits in terms of the human bridges, the MoUs. I love that, the living bridges you called it. And I think, we have a great opportunity here to work together, and but build opportunities and relationships, and really make a difference. It's a real, those people that know me know how much I'm very passionate about the global nursing and healthcare agenda. We have an opportunity to influence, and we have an opportunity to really make a difference. And it's been so enlightening today, meeting so many of you, and with Tista and Rima earlier. And I think we'll definitely be connecting. We'll definitely be sharing, experiences together, and we want to share that with many others overseas. So we're hoping this will be a start of, future working relationships together. And I think we've just got such a great opportunity that we can capitalise on that. Thank you.
And and just to say, for an academic purposes, I did not coin living bridges. Living bridges is something that I think the UK and India have been doing really well with, actually. And when I say really well, we were having this discussion earlier, weren't we, Tracy, around living bridges? But can bridges really be living? They probably can't they, depending on what they're made of. And I think there were some real synergies, aren't there, between what we're doing locally, regionally, nationally, and globally. It's just, I don't think we're not doing enough, are we? We're not joining the dots when we see how interconnected things really are. And I'm so delighted that Dom's here today, because Dom is going to be taking a new leadership role within Health Careers Live in a few months as one of the driving forces. When I say it's a cumulative driving force, but it's so great that Dom has this opportunity to do this within the NHS, because even now, the structures in place, the institutionalization, or the whole, I'm going to look at someone on the internet and they're great, how am I going to follow their journey? But actually, it's what's happening already. It's how we're supporting people to really live their best lives and ensure that they have the support available. And on that note, Tista can't be here from the General Medical Council, but it's been great to hear how the GMC are really taking things forward as well. I'm waiting for some, actually let's put the floor now. So it's great to have thank yous, but we want to have your thoughts. How are we going to change things for the future? Is there anything that you didn't see today that you'd like to see next time? And would you like to speak? Because we'd love to capture your experiences. So on that note, how do you see the future of healthcare? That's a really interesting one. And I'm glad you asked that question, because I have my digital stethoscope somewhere here, which in true tech fashion has vanished. But the future of health is a really interesting question. And who would you like to answer that question? Okay, so what we're going to do is we're going to take that forward as a session. And Dina, we'd love to invite you to be a host of this session at Health Careers Live Festival. So please do get in touch with the team, and we'd love to hear your views on that. And I think, with it being 12:46, I think we'll do a really good thing. We're going to finish early, so you can have a nice stretch. Pathway for PhD holder in the UK. Would you be happy to take that, Tracy, over email? There's a question from Victoria, which is a really interesting one around what is the pathway for PhD holders to work in the UK? Do I need to register as a registered nurse or to get an NMC pin? If you send that to us over email, the email is info@healthcareers.live. We'll be able to help signpost you in the right direction, whether that be with Tracy, who's gratefully giving up her time today, or the Nursing and Midwifery Council. We'll be able to link you up with, yes, that would be great. And please do keep the questions coming, because we are here for you throughout the year. And if there's something that we see that's particularly, we're seeing a high demand for, we really do try and run sessions during the program. There is actually a massive resource online already, which has captured over 100 sessions that are all on our YouTube account. You can see them on the website and search through the sessions. And of course, if there's anything that you found useful yourself through other resources, please do share them across and we can help share them online. At Health Education England, we are creating more open access resources. So you'll see a lot more around the Learning Hub in terms of how everyone can actually add their own resources and make this a real crowd-funded effort. Partnership building, how does it work? I think we'll have to invite Jed back again for that, and Tracy. We'll have to do a bespoke session of partnership building. So, Jed's still here. That was a question for you.
I am Jed. Indeed. Do you want me to have a?
Yeah.
Yeah, I'm glad somebody asked me that. A couple of things. So the first of all, I'm intrigued, even though I wasn't able to attend the session this morning, about the notion of digital memorandum of understanding. What is perfectly clear to me, that if you're going to be the best that you can be as a healthcare professional, whether that be a frontline clinical healthcare professional or part of the backroom engine room, which is so essential for making local and national health systems work, then you have to understand cultural difference and differences in clinical learning environments, particularly in a world where we have so much mobility at the moment. And the academic discourse behind this is all about partnership. What we're talking about in partnership really is in three broad categories. One is partnerships between governments, which are extremely important because policy and top-down decisions to work with other countries, other nations, other regions influences an awful lot of the direction of an overall healthcare system. And certainly we have government-to-government health-related policies with a wide variety of different countries, including several in the Middle East. Sitting below that is organisation-to-organisation partnerships, and this can either be a place, so somewhere like Central England and say a state in South India, where both of the partners come to the table saying, how can we create systems which are mutually mutually strengthening by working together. And this might involve shared knowledge, shared resources, shared research and innovation, exchange of staff, etc. And then or it could be institution to institution, and there are lots and lots of these across the world, both what we call north-north partnerships, which are those between established large, very famous institutions like Harvard and Imperial, for instance, or north-south between established universal health coverage institutions. So, for example, we have a partnership between Leeds Hospital, which is a very big teaching hospital in the north of England, and the Caribbean island of St Vincent and the Grenadines, which allows a dynamic relationship to occur where each partner can assist the other in terms of their own health system strengthening. But sitting below all of this are people-to-people partnerships, and I think we've not done terribly well on this. And so there's a couple of questions I want to pose to you. So the first is, given that we've probably been through the most torrid health-related time in our history over the last 2.5 years, if the director of Hospital Number 2 in Wuhan had a direct and personal relationship with the director of Porton Down, the infectious diseases laboratory in the UK, if they had had a long-standing relationship, would we have had a pandemic? And the answer is probably not. But the problem is that what we tend to be as healthcare professionals is focus vertically on our own healthcare systems, whereas actually the key to health and well-being is focusing horizontally with our neighbours who are either better off or worse off than ourselves. So, and the second question I'd like to ask, really, and maybe something you can take away with you, is how do you want to get involved in partnership? Because you're not going to be the best that you can be unless you've got partners, unless you're part of an institutional partnership, and unless you've got peer relationships with other people across the globe in different clinical environments from yourself. So key message for me, partnership is key. There are multiple ways of doing it, but obviously right at the heart of everything that we do.
Amazing. And I think, I think just that really echoes and so the same environment we have in hospitals or clinics around those peer-to-peer relations. How are we going to take those locally and globally to share knowledge? And on that note, Dom, I wonder if you wanted to share a bit more about ICGRX and how that interplays with this. And it's great to have Faisal join as well, who has been amazing today. And it's the first time we've Faisal has joined. Well, actually, we have Faisal and Tracy are almost Health Careers Live newbies today, except now part of a massive peer-to-peer family. So, Dom, over to you, and then Faisal, if you'd like to say a few words around the exchanges.
So thanks, Rod. So ICGRX stands for International Collaborative Ground Round. It is much like Health Careers Live, another online platform seeking to share healthcare knowledge and improve healthcare outcomes globally. Whereas Health Careers Live tends to be more career-focused, International Collaborative Ground Round tends to be more focused on health. And that's something that we have run a number of sessions over the last couple of years, various different subjects, such as related to systemic and sort of more with a greater clinical focus. I think partnerships are absolutely crucial for making these kind of things work. We're very reliant on partnerships with institutions and organisations so that we can recruit speakers who are able to provide the level of insights and the calibre of knowledge that we're seeking to share. But I think also with a view to developing the platform as as a more traditional ground round format, I think that are going to be crucial in that sense. Journal, potentially with companies to facilitate the content and the aspects we want to deliver.
So that's an open invite from Dom. If you'd like to be part of the open exchange knowledge exchange, which is probably a bit of a double barrel there, but really connecting the dots, aren't you, Dom, around sharing. In a way, in healthcare, I don't think you can overshare, can you? The more we know, the more we realise the less we know, because we aren't connecting enough. And I think the pandemic has shown that more than ever, hasn't it? With being up to date. So, Faisal, over to you.
Thanks, Raj. And again, it's, I think, just wonderful seeing the exchange of insights, perspectives, experiences being shared here. This is exactly the platform and conversations we need to stir global health innovation that's coming around. And we've been seeing this, since the beginning of the pandemic era, but it's time we now look at what the action plan can be. We've got a lot of questions, we've got a lot of ideas and thoughts spewing around, but how do we bring it together? And I think that's where partnerships really come to play, because you've got the right people on board, you've got the right collaborations in the making. It's really about pushing this forward with the right leaders on the front for such organizations. As someone who's now representing the exchange lead aspect of Health Careers Live, I think this is a crucial role to play, where we're looking at creating opportunities, allowing space for everyone from trainees to professionals in the healthcare field to come together and see how can we create opportunities for exchange placements to happen. This can be remote placements, on-site placements. The ideas and possibilities are endless. It's just a matter of having the right people listening and being open to the idea of diversity in such working environments. So looking forward to really seeing where such placements can take us and many others who are joining us at Health Careers Live.
And it's so great to see your energy, Faisal. I think particularly as a medical graduate who, and in a way, we've both grown up on social media. I think a lot of us have grown up on social media, which has actually probably made us more 360 in thinking, because we're really getting it from all directions. I don't think the notifications stop pinging. And on that note, there's been a tremendous amount of work at Health Education England that has taken place already around global fellowships. And I'm really hopeful that this will continue for the long term. I think one of the difficulties of the pandemic has been those lack of face-to-face opportunities. As despite how technologically advanced we become, I don't think we're going to quite replicate humans. And I think there's something very special about being together, in whether that be in a GP surgery, whether it be in a rural clinic or in an operating theatre. Some may argue that we are nature's most advanced machines, and health and care, there's a real opportunity to push yourself to the nth. But please don't burn out. And on that note, because I've mentioned it, mental health and well-being is really important. And as healthcare professionals, as students, as aspiring healthcare professionals, and senior leaders have tuned in today, taking time out, going for that walk, drinking that extra cup of water, and taking that time to just be you. Because unfortunately, I think it can be quite all-consuming, and people look to us to be figures of authority, or tell us what to do, or can you help us with something that will, guide us in life? But I think sometimes it's around ensuring that there is support for each other. And on that note, there will be a strong focus on what we call living your best life, which sounds quite cliched, but actually is really needed, particularly for my colleagues who are finding it very challenging, and myself finding it really challenging to be in a very pressured system. And it's great to see, people like Dom having the opportunity to do major trauma fellowships. And I think we need to be doing a lot more of this. So I'm really looking forward to welcoming you all to the other roundtables, and a big thank you to the Health Careers Live team, the Virtual Studio Live team, and the General Medical Council for supporting this endeavour that's now 5 years old. And I'm just so grateful that I've had the opportunity to meet all these amazing people and meet you all today. So thank you so much for being here. You are. Keep being amazing, and hopefully we'll see each other very soon.
Thanks very much, everybody.
We're doing a silly pose now. Is this the way?
Thanks very much.